Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in adult transgender care. Welcome to my channel and welcome to our Q&A series. This is the place where you get to ask me your specific questions. All you got to do is email your question and keep it brief. My email is in the description box below. And then I select random questions for Q&A, put all of the questions in a folder so I can ensure you everybody's question does get answered. I block out, as always, everybody's information so that way we keep everything private and confidential. And I put down timestamps below. So if you have a question for me, my email is in description box again. Email me your question. Having said that, my regular viewers probably already noticed that I am in a completely different setup. I'm not in my regular office setup. I am traveling to Pacific Northwest to take care of my mama for her cornea and cataract eye surgery. And so I'm in her uh, somewhat disheveled office downstairs. So I have to make the best use of it. Which is, for me, aesthetically, being a person of aesthetics, it's driving me ballistics. But you know what? We gotta get the work done. We gotta get the questions answered. And I usually don't pre-record Q&A videos because I wait to have enough questions to draw from. So this is kind of organically happening. So for that reason, we're different location. The only thing that I want to mention is I will try to make the sound the best that I can, but I don't have my usual microphone, so I'm using my camera. Hopefully it will pick up sound and we're going to have nice and clear sound on your end. One more thing. I'm noticing that some of the questions that some of you emailing me are starting to be a little bit lengthy because you're starting to include your personal context, historical context, which is fine by me. I just don't want them to get too lengthy. But I do want to ask viewers, I want to ask all of you, does having a little bit more context in somebody's situation helps you? If it does, comment below, let me know. If you would prefer questions to be as brief as possible, let me know. So that way I can modulate them as they come in. Other than that, I have selected 5 questions. Some of them do seem lengthy, so if we're gonna get into like 40 minutes recording, I'll cap it at 4 and then carry over the 5 questions for the next Q&A. But hopefully we'll be able to answer it within 40 minutes to an hour. I don't want to keep Q&A way too long for everybody. Having said that, let's get rolling. I'm going to grab a pen so I can put down around the timestamps occur. Question number 1. I have been a reluctant trans non-binary person for close to 40 years now, still face ingrained resistance, and I'm starting to really see more and more this part of me as a blessing rather than a burden. Do you have any tips for how to help decondition resistance, or is it a matter of reconditioning acceptance, belonging, and appreciation? This is a really good question. It's a very good question because resistance is so incredibly common for so many of you. Resistance when it comes to gender identity in today's world is almost impossible not to experience. It's almost an experience that almost everybody is going to some way or another deal with. And this is a really good question because this person is saying that they have been reluctant trans non-binary for 40 years. So that's 4 decades. That's a very long time. And they're starting to actually see that as a blessing versus a burden. And I'm assuming the reason why you're seeing this as a blessing is because, sometimes resistance can be, well, when we resist to step into who we truly are, then we further also resist from experiencing any challenges that can come with that. And certainly staying in a current position and also not stepping into your authentic self has its own challenges as well. So I can see how for somebody who's been kind of resistant to really acknowledge their gender and stepping into it for 4 decades, at this point they may be wondering, maybe that actually served me because I didn't have to deal with any challenges that may come with stepping into my identity. And the question is a really good one, whether you need to decondition resistance, or is it a matter of reconditioning acceptance, belonging, and appreciation? And the answer, in my opinion, lies in what are your goals? It's been 4 decades. How do you feel? Do you feel like you want to continue this life of being very reluctant trans non-binary person for another maybe 4 decades? Do you feel like you're in a path of your life, at a crossroads in your life, where you are earning, you are desiring, you want to be much more closer to yourself, you want to be more connected to yourself, you want to accept your identity, you want to start finding a group of people, community, where you can start to feel a sense of belonging? That is a personal question. Some people say, I've done it for 4 decades, I'm just going to keep on doing it. Everybody has a right to decide what's best for them. Some people, they come to decision and they say, you know what, it's really starting to eat at me, and I gave it 4 decades of resistance, and now I'm gonna flip it and give it 4 decades of acceptance. If you are going to want to move, if your goal is going to move toward acceptance of your identity, then I would say it's not so much reconditioning acceptance, it's just more recognizing that there's resistance and doing some deep research. I always say journaling is fantastic. What is it that you're resisting exactly? Resistance always arises, almost always, out of fear. The root of resistance is almost existential type of fear. What is going to happen to me? How is everybody else going to take my identity? And it's also a fear of abandonment and a fear of alienation. What if everybody abandons me? What if nobody's going to love me? What if nobody's going to want to be around me? Which is a very reasonable fear to experience. But a lot of times, fears that may feel reasonable are in reality quite unreasonable, in a sense that there's probably very small probability of all of your fears coming true. And so instead of reconditioning acceptance, I would say really dig into what is the resistance is about? What are the feelings underneath resistance? Why are you so reluctant to acknowledge who you are? What scares you about stepping into your identity? Can you move slower, take slower steps, so that way you chip away at that resistance with each step in the way? That's what I would recommend. This is a really good question. I think a lot of people can resonate with it. I think especially right now, for a lot of people who have been reluctant for many years because of what's happening in the world right now, a lot of people are asking me, what if I just don't do anything for another X amount of years? And that's a very personal type of question, and I can understand where it's coming from. I also know that a lot of times when we think we're not doing, we're going to continue to be reluctant and resistant. We think we are preventing ourselves from feeling pain that may rise out of resistance, and then we end up feeling a different kind of pain. So I encourage you to think about that. Great question. Question number 2. As a gender fluid person that presents as assigned male at birth, I get periods of dysphoria where I feel really sad for not having been born female, but also really good feelings in imagining what it would be like to have more physical characteristics of a woman. Recently, I have allowed myself to really feel these big feelings in my body, and it has felt so relieving in doing so, more so than any amount of cross-dressing I've done in the past. This feels like an important part of my transition and has helped in accepting the divide I sometimes feel between my inner view of self and outer. I'm just wondering, what are your thoughts maybe on this? Any additional tips, and whether this is a healthy aspect of growing through dysphoria, especially if not pursuing hormones and surgeries? Again, great question. As for somebody who identifies as gender fluid and then starting to really step into these bigger feelings and allowing themselves to feel these bigger feelings in relationship to their body and therefore in relationship to their identity, things can come up to the surface. Sometimes by stepping and allowing ourselves to really lean into what we're feeling, to really sit and lean into what we're experiencing. What may arise for some of you is that maybe your gender fluidity is more leaning towards one end versus the other. Or maybe gender fluidity has been an identity that was something that was resonant up to this point, but now you're realizing there might be something else. And that type of awareness can also be overwhelming and confusing. Whether this is really aspect of growing through dysphoria, I don't know about the wording growing through dysphoria. To me, what sounds like you're experiencing is you are starting to, by allowing yourself to just, again, like I said, leaning into all of those feelings, you're allowing yourself, almost like you're granting yourself permission to go there to feel it. And it's not necessarily growing through dysphoria, it's just you discovering things about yourself, you discovering things about your gender fluidity. In my opinion, self-awareness in our inner selves is always a fantastic thing. I think the whole premise of being a human being is to continue to become as self-aware as possible, because we are incredibly complex. On top of that, we're also constantly evolving and constantly changing. This is why I always say gender identity is not fixed for a lot of people. Some people may have identified as gender fluid for decades. And then towards the other decade of their lives, they may realize that, a particular trans identity fits more closer to them. This is just a testament that we're not stuck in one place. It's a testament that just like anything around us is changing, we are bound to change too. Not only change externally as we get older, but also change internally as we gain more experiences, and therefore as we experience ourselves in different scenarios, in different relationships to ourselves. This is all natural. This is all part of development. This is all part of being human, is to navigate those experiences from inside out. So I think my advice to you would be lean into it more, explore more, go there, see what it tells you. You mentioned that you do have quite a bit of dysphoria when you think about not being born female, but also you have good feelings imagining what it would be like. You also you mentioned a lot of relief in allowing yourself to feel these feelings. And I think even more so than feminizing. So it sounds like just allowing yourself to go there in your headspace is something that gives you inner peace, gives you a connection to yourself, gives you joy, and as a result, decreases dysphoria. I think this is all great. Look, in my opinion, again, this is just my opinion, and I'm always going to say this, even though I'm very specialized in this, in the end of the day, it's just still my opinion, right? So we still take everything with, even from somebody like me, if it's a grain of salt. But my personal opinion is that if you are doing something that is not a negative coping, that helps you decrease internal pain and increases your connection to yourself and makes you feel better, I think that's a huge win. I think that's great. If you're leaning into feelings and they make you connect to yourself and decrease dysphoria, lean into those feelings. There's no need to be on the end of a pain spectrum. There's no need to experience pain. A lot of people feel like they gotta feel this pain because it validates their identity. It validates they're truly trans if they have this pain. And it's in my opinion, it's quite a masochistic notion. Pain points a lot of times are very long, very loud, very loud alarm bells going off, letting us know that, whoa, you really need to pay attention to this. This has gotten so far out of hand. That's what really dysphoria is. It's very loud ring bells that just says, hello, wake up. Uh, just like any other pain point that our bodies tells us. But remaining in a pain point, if there's a way to alleviate that, it's, yeah. So that's what I would recommend. I think that if this is helping to you, and especially decreases dysphoria, yeah, lean into those feelings. That would be my advice. Great question. All right, question number 3. I think we're moving really well on time here. Okay, so this is a big one with a big context. I'm assigned male at birth and 37 years old. I'm okay with being a man and feel comfortable living my life publicly as a man. I don't mind other people seeing me as a man. However, I also fantasize about being a woman. Sometimes I will see a woman in my daily life or in a movie or on TV and want to be her, which I usually call classic gender envy. If I woke up one day and had a female body, but was able to change back permanently to being a man, I would live life as a woman for several months at least. I also like feminizing in private. When I feminize, I sometimes feel like I'm expressing my true self. When feminizing, I feel some dysphoria about my male characteristics and I tend to hide them, but I don't really feel negatively about these characteristics with not feminizing. That makes sense. I'll explain why. I've had this desires to feminize and fantasies about being female since I was a teenager. I recently accepted that I fall under the trans umbrella and have started exploring my gender in private. And it has made me happier than I've been in a very long time. That's also a sign, right? But now I worry that I'm just trans imposter who simply enjoys feminizing. Since I'm okay with publicly living as a man while privately feminizing, how do I know if I am an imposter or really trans? So honestly, I really don't like this word trans imposter. But I understand what you're asking. You're struggling to understand your experiences because you are assigned male at birth. In your daily life, as you describe it, in your daily life, in your daily interactions, you feel comfortable in your assigned gender. You don't have any dysphoria in your assigned gender. You feel fine navigating your life in your assigned gender. But when you do feminize, which you also really enjoy, and a lot of times sounds like you experience gender anywhere you do experience yourself as a woman. When you do feminize, you then experience dysphoria. And that adds a little bit confusion. So for starters, the reason why you may experience dysphoria when you do feminize and suddenly those male features are very uncomfortable for you is because they are in juxtaposition to femininity. A lot of times people may, and I see this quite a bit, a lot of times people may feel comfortable in their assigned male gender because it's only shrouded in masculinity. And so there's a sense of neutrality for some people. But the minute they feminize, there becomes this parallel where both masculinity and femininity exists for a lot of people. And then that can bring up quite a bit of discomfort. I have a video about this where for some people it actually triggers inner transphobia, where they feel like they are literally, what they might feel is that, oh my God, I look like a man who tries to look like a woman. Because depending on your masculinity and masculine attributes already, it becomes that juxtaposition, feminizing in combination with masculine attributes. And for some people, it is very uncomfortable. And as a result, inner transphobia or maybe some other factors, it will bring up dysphoria. I even have, like in that video, I caution people about it because a lot of people, when their egg cracks or when they just realize, one of the first things people will do is just feminize. And which can be incredibly affirming to a lot of people. For a lot of other people, it does the opposite, where things come up and the dysphoria spikes up so high and the discomfort is so grand that people just run in opposite direction. That's how actually repression happens for those individuals, and then they don't do anything about their gender for years or another decade. And so I caution about that because that's just really unfortunate. So you might be experiencing that when that happens. And a lot of times people actually take this as a testament. Oh, then I'm not really trans woman. My gender identity is not trans feminine because I'm feeling so much dysphoria when I feminize. I'm so uncomfortable. But it's not that you're so much uncomfortable necessarily in a feminine identity. It's just that more you're seeing the juxtaposition of masculine and feminine traits, and they're almost throwing your perception of yourself, and you're so caught up in a visual, you're not really allowing yourself to drop into your feelings. But how do you feel in that moment? What does it feel like for you in that moment to project yourself outward in the feminine? And that's really important for people to sit with and to ask themselves about. So as a result, you're now worrying, what if you are trans imposter, by which I assume what you mean is maybe I'm just a man who likes to feminize, period, and enjoys feminizing. But I think I might be trans woman. But what if I'm just lying to myself and as a result, trans imposter, when in reality, I'm really not trans. Especially since you're okay publicly living as a man. A lot of people are comfortable publicly living as a man for a lot of reasons. It could be that they're still in a state of denial. It could be that they're genuinely comfortable. It could be that they have a lot of reasons. It could be lots and lots of reasons. I think what you're missing here is a deeper exploration, a deeper exploration into how do you feel about your assigned gender, and how do you feel not what you see in the moments when you're feminist, but how do you feel when you embody the feminine. I think it's also important for you to pay attention to your fantasies about being a woman, your fantasies about when you see women in your daily life and wanting to be them. I've done a video about this where I discuss that people who just feminize for whatever reasons, remember, feminizing or cross-dressing doesn't just occur for sexual pleasure. We're socially so brainwashed to just think, oh, cross-dressing, fetish, sexual fetish. People cross-dress and feminize because it just feels good, because they want a gender band, because it's creative, because it's fun. Numerous reasons. At the same time, they are more anchored in their particular, most likely anchored in their assigned gender. And so when they're done feminizing for whatever reasons, it's almost like there's a barrier. For people who are maybe more leaning toward trans identity, the barrier doesn't exist. And so the person is in day in and day out life, when they're navigating their life in their assigned gender, in their assigned male gender, while feeling comfortable being a man, they will also fantasize constantly about being a woman, imagine what it's like to be a woman. And in my opinion, that's something else altogether. What is it exactly for each person varies. It's equally not an immediate, oh, if you fantasize about being a woman, then you're definitely a trans woman type of scenario. You, my friend, need more exploring. You, my friend, need to dive a little bit deeper into how you feel about both your assigned gender identity beyond just, I'm okay publicly living as a man. Tell me a little bit more about it. What about it? What about being a man that resonates with you? What about being a man that the gender identity that aligns with you? How do you identify as a man? A lot of times when people start asking themselves those questions, they find out a wealth of information about themselves. A lot of times they find out that, yeah, this is their gender identity and they're very comfortable, and they just need to acknowledge that feminizing is also part of the repertoire. Some people find out that as they dig deeper that what they're saying is that it's easy to navigate life in their assigned gender. Easy. But if they could flip a switch, or but if this could happen, or but if that could happen, they would change their gender. That's a different story altogether. So I recommend for you to explore a little bit more. There's no clear-cut answer here. I would recommend, again, I always say journaling is a fantastic way. Working with some kind of therapist in your area would be a great idea, but to explore this a little bit deeper. Great question. All right, question number 4. I'm trans female who is physically disabled and traditional forms of feminizing, such as makeup and wearing feminine clothes, will likely be difficult. I also foresee challenges in finding trans-affirming caregivers. As for now, I'm not interested in medical transition. Is transition possible and worth it for me, all things considered? Thank you always for fantastic content. You are so welcome. And I'm really sorry to hear about your challenges and struggles. Is transition possible and worth it for you, considering your circumstances? In my personal opinion, I think transition, and remember, transition is so broad. It can range from spiritual transition, which can range from inner self-acceptance, inner ownership, inner connection to your womanhood, inner connection to your sense of womanness, to social, where you outwardly express yourself in a way that is more aligned with yourself, to medical, to surgical, to legal, to transition is very broad. So keep that in mind first and foremost. In my personal opinion, I think some element of transition, whatever is fitting and conducive and within the context of your situation, is always worth it, because that means we're moving you closer to who you truly are, and moving you closer to being able to express that identity as authentically as you can. And anytime we as human beings move closer to who we truly are, we equally move closer to being happier, because trust me when I say this, and all of you know this, it takes tremendous amount of energy, tremendous amount of strength to pretend to be something we're not. And it never works long term. It always feels exhausting, and it leads to anger, stress, frustration, tension build up, health issues. So in my opinion, anytime you can move closer to who you are, in my opinion, everybody should do that. And you're already aware that due to your physical disability and other limitations, medical, maybe some elements of transition may not be an option. Okay. But here's the thing. What are the other aspects of transition that can be an option for you? Certainly, in my opinion, spiritual aspect of transition, as I said, is inner self-acceptance, ownership of our womanhood. All of those aspects, I think, are accessible to everybody. It's an inner work, right? And I encourage for you to think for yourself what within the scope of your circumstances is possible for you. There's a lot of people who cannot get medical transition because of the health issues. But then they also don't stop there, to continue to express themselves. There's a lot of people who can get surgical aspects of transition because of finances. It doesn't also stop them from stepping and owning who they are to the extent that it feels comfortable and safe and possible for them. I'm not a believer, and never ever will I be a believer, that trans identity only exists within the scope of full, especially medical and surgical transition. Medical and surgical transition never ever defines trans identity. There are treatment supportive things to help people externalize and to help people alleviate physical dysphoria. But they don't determine, they're not identity qualifiers don't determine identity. Your identity is within yourself. Your identity exists before you even decide if you want to transition or not. So, yeah, I think you have a lot of options on the table if you just start looking at transition in a much more broader steps. I don't like also the word transition. I know a lot of you also don't like the word transition because it implies moving from point A to point B. And a lot of people feel like that's very, and I agree, it's very limiting, especially since we're constantly evolve. I love the word evolution. I love the word blossoming. I love the word evolution primarily because that's what we do as human beings. We continue to evolve. So, who do you want to evolve into today? Who do you want to evolve into a month from today? Next year? How much, in what way do you want to externalize your femininity? Not only externally, but also internally. I think once you're going to look at transition period in a broader sense, you're going to find things that are going to help you move closer to yourself. That's what I would recommend. Great question. You're definitely not alone thinking about this type of things and thinking, whether it's going to be worth it for you, all things considered. My answer is yes. And finally, question number 5. Looks like we'll be able to get to it. We're at 31-minute mark, so great. Question number 5. Another lengthy question. So again, please do let me know whether questions with more context like this is a good thing for all of you. Because sometimes, like I said, a lot of context can help people find things that they resonate with. I'm a trans woman from Eastern Europe. I started my transition at 34 as soon as I fully understood myself, and now I'm 35. I had objectively good results in small. I've developed a feminine body shape, and I'm read as a woman in daily life. But even so, dysphoria still affects me deeply. I struggle with facial hair that I haven't been able to remove yet. Sometimes I feel overwhelming jealousy toward trans women who had vaginoplasty, even though I'm not sure how much I'd actually be dysphoric about my genitals in intimate situations. I've never had the chance to find out since I haven't found a partner, not even for one night. Lately, my voice has also become a source of discomfort. And more than anything, I feel strong envy toward younger trans women who were able to start transitioning at 20 or even earlier, who got to live their youth as girls. At the same time, I know these are trans women who might envy me. For my starting point, for my current appearance, or for having figured things out in my 30s instead of later. How can I learn to accept where I am and find more peace in what I do have instead of feeling stuck in what I missed? This is so good because this is so relevant to so many of you. So many trans women, especially that I work with, experience this comparison trap. Not only comparing yourselves to other trans women, but also this feeling of regret of not starting sooner. And then a lot of times people also feel transition guilt, where you're starting to feel guilty for even feeling a particular way, because actually should do a video on this. Okay, I'll write down here. That's how I get a lot of my videos ideas, where you start feeling guilty for maybe resources you have, of how far along you are, or how hormones may have feminized you more than somebody else's. And so there's this juxtaposition about not feeling like you have enough, but also feeling guilty for what you do have at the same time. It is challenging because this individual who's asking this question is only a year into transition. I say only because, ladies, you are emerging and evolving. You are going to continue to step into your womanhood for the rest of your life. And your womanhood and your relationship to yourself as a woman with transgender history is going to continue to evolve and change. The way you see yourself now is not the way you're going to see yourself 5-10 years from today. So a lot of times people have this, without even maybe realizing, a very limiting idea that they transition, they do everything that they think they're out to do, and then they wonder why they're still internally unhappy, why there's still this void. And as I always say, transition is not just external work. External is incredibly important. Changing your body appearance changes your overall appearance. Other things that maybe make you feel uncomfortable are vital. But internal work, in my opinion, is even more important. And internal, first and more, starts with not only with acceptance, but also with a deep understanding of what is your womanhood means to you. What does it mean to you to be a woman? Because in the beginning of transition, it's very easy to get lost in all of these ideas out there perpetuated by society, cis women, trans women in community, of what you ought to do. But you need to realize which one of those things actually belong to you, what resonates and what doesn't. And so it's easy to fall into the trap, especially in the beginning of the year. And this is also why some of your dysphoria is starting to come up around some elements. Dysphoria will also fluctuate, my friends. It can fluctuate throughout your transition. It definitely can fluctuate even after transition. Dysphoria is one of those things where you may never feel dysphoria about a particular body part and then only realize you are starting to develop it, because as you evolve, things about you change. How you see yourself change. And what maybe did not matter, starting to matter to you now. Think about genital dysphoria, which is a very common one to fluctuate. I've seen so many trans women who started out with not having genital dysphoria, very adamant and certain they're not going to get genital surgery, only then suddenly realize that, oh, now as I'm actually changing and dealing with physical dysphoria and feeling much more congruent about myself, now my genitals feel deeply incongruent to me. And as a result, the dysphoria around genitals starts to spike up. So dysphoria will also fluctuate. How can you learn to accept where you are at and find more peace with what you have? My first piece of advice is try to catch yourself when you are being trapped in a comparison trap. We're all bound by comparison one way or another, because we live in a world where we're constantly being fed visuals, and beyond just visuals, especially with social media, constantly being, especially for all of us as women, with any kind of history, for me with cisgender history, for you with transgender history, we're being fed constantly information about beauty and beauty standards, and you absolutely need this, and how old are you, you haven't had whatever. So the first is to recognize when you're starting to be critical on yourself and you're starting to get yourself in that mental trap of starting to tell yourself, convincing yourself you need something, and to step away from that and to start really asking yourself, do I genuinely need this, or am I being blindsided because I think the grass is greener on the other side? At some point, I encourage everybody who is transitioning or transitioned to start stepping away from transition related, how should I say it, transition related things, to start realizing there's so much more to you than just your gender identity. Start paying attention to your passions and your interests. Start focusing on other elements of your lives that needs to be focused at. I think it's very easy to see your life only through transgender lens. And in doing so, one really limits themselves on all other aspects of themselves. So I really encourage to move away, create some distancing from it. I also really encourage a lot of women to work on their inner self-worth, inner self-value, What are the things about yourself that you find that are worthy, that are beautiful, that are valuable, that are things that you actually feel confident and good about? Can you identify those attributes? Can you write them down somewhere where you can remember and hold on to them? During especially moments when you feel envy toward other women for something they have, and then feel like you don't have something, to remind yourself that I may not have this, but I have this. It's really important to have things that we can hold on within ourselves, because you're never going to be 100% perfect and you're never going to have it all. Another thing is to recognize that not everything is for us. Like, not everything is for us. Not everything that we see out there is meant for us, and that's okay. That's okay. And to find a way to let it go. Internal acceptance and that inner work is the hardest component. This is why I have went on and I created Circle of Trans Womanhood membership. If you haven't, link is below, for women with transgender history, because after 2 decades, the most common theme that I see is imposter inner feelings. Feelings of I'm not good enough, I'm not a woman enough, I'm not pretty enough, I'm not feminine enough, I'm not enough. I've seen this in women pre-transition, mid-transition, post-transition. And it saddens me because I have so many trans women who tell me, I don't get it. I feel great. Everybody acknowledges me as a woman, and yet internally I still struggle, because internal component is something that's missing. Internal component is something that is being missing so drastically from even social media. It's hyper focus on external transition aspects, which without a doubt is important, but you need both. You need internal as well. And that's what my membership is about. And the workshops that I created are all on beating the imposter and focusing on internal components. This is why this work is so important, and it's really, really hard. And there's no one quick answer. How can you accept yourself? It's doing that work. It's meeting yourself where you at, and giving yourself grace and compassion where you at, and acknowledging where you at, and learning how to love parts of yourself versus comparing yourself to somebody else out there. But it is hard work, but it's possible, and I see women do it every single day, and I know that each one of you can do it as well. Great question, great set of questions for today. I hope the sound was good. I'm flying back this Saturday, so next Q&As will be from the home. But as much as the vanity in me is like, oh my God, I hate the backdrop, I just have to let it go, and I just have to let my ego out of the way and say, you know what? People send you questions. They would really love to hear answers or some suggestions and tips and guidance. And right, we're here for the content, right? We're here for each other, for support, not so much for the backdrop. I mean, I am, but that's my ego vanity. Anyhow, feel free to email me your questions. Let me know if more context from people is helpful to all of you or not. And yeah, and I hope I will see you all in the next video. Have a great day. Goodbye.